The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome to Pain Free Today. We have a number of questions that were asked by listeners last week via email, and I'll get to those later on in the program. First thing I'd like to do is, for those who are new to the show, is kind of give you a capsule view of what the ARP Wave System is. And it is just that. It is a system which will allow you at any age to move freely without pain. Henceforth, the name of the show, Pain Free Today. Now, many of you out there who suffer from pain, and many providers out there who are treating pain, typically treat where the problem ended up, not where the problem is coming from. What we've done is devised a very unique system where we can identify the neurological origin of your pain. So if you have pain anywhere in your body, understand this. Wherever you have pain is where the problem ended, not where it's coming from. And the majority of providers treat the symptoms because that's how we are educated to treat pain, is the symptoms. So I'd like to introduce you to a completely different point of view. And for the providers out there, we are looking for providers in the Florida area to support our patients. So we have more patients than we do providers right now. So if you are a provider listening to this show, please get in touch with us afterwards so we can get you set up to be able to treat this vast number of patients that we're creating on your behalf. So anyone in pain, and that is the number one complaint administered by almost all doctors throughout this country and throughout the world. And pain is epidemic. And pain can come in a variety of different means. It can be something that is just nagging, or it could be something that literally can prevent you from having an active lifestyle that you deserve. So let's look at the phenomena of pain. And one of the most common forms of pain is back pain. And traditionally, what is done is medication, which basically masks the feeling of the pain, but does absolutely nothing for the pain. There's all sorts of physical treatments that address the pain. What I'd like to do is introduce a completely different way of looking at the pain. And think of it this way. Again, wherever you have pain is where the problem ended, not where it's coming from. So in the ARP Wave system, it is a three-part system. The first thing we do is we find out, is the software, your nervous system, which drives everything in your body, is it working correctly? And we give a very simple test. And we utilize the muscles of the body because they are an outward expression of the nervous system to determine, is your nervous system sending the right signal to the muscles at the appropriate time to allow the muscle to act as a shock absorber. Because if it isn't acting as a shock absorber, all of that force coming into your body is going someplace that it's not supposed to go. So the first thing that we have to do is we have to identify, is the software working? Is your nervous system working correctly? That takes roughly about 10 to 15 minutes. And in that process, we're testing the muscle to determine, can it absorb force? Now, for the providers out there, what we're really testing is the neurological signal to the muscle fast enough and aggressive enough to turn the muscle on fast enough to where the antagonist and the agonist will act as a shock absorber instead of acting as a protector. And when it acts as a protector, it concentrically contracts. And when it concentrically contracts, it no longer is able to absorb the amount of force it can when it's eccentrically contracting. So the first thing that we're going to do in our system is identify, is the nervous system, and we call that the software, is the nervous system working correctly? Now, if it is not, then we have created very unique protocols by which we can basically, for every individual, customize a way of getting the nervous system back firing again. Now, once it's doing what it's supposed to do, and that might take 10, 15 minutes, once it's doing what it's supposed to do, the muscles now can start to absorb force. So now it's like the shock absorbers are working again. But since they haven't been working for a period of time, doesn't it make sense that there might be some damage caused by all that force going to an area that's not supposed to go to? And, of course, every single person listening today has that same phenomena going on right this second. So now we got the shock absorbers working, but there's a lot of damage caused by the force going into joints and going into tendons, going into ligaments that it shouldn't have been going to. So the next step in the system is identify exactly where the signal is that's causing the muscle not to do what it's supposed to do. And we use a very simple technique with a highly proprietary tool that can only be utilized by our providers. And that tool will identify as a diagnosis exactly where the neurological breakdown is. Now, once we identify where the neurological breakdown is, we can obviously treat it. So now we're treating the beginning of the problem, not the end of the problem. And only when you treat the origin of a problem are you going to get rid of that problem. So I tell many of the providers who are in the pain business, the pain doctors listening, when a patient comes into you and they're exhibiting symptoms of pain, traditionally what happens is you're almost relegated to putting them into some form of medication to get them into a comfort zone. What I'm saying now is that when that patient comes in, you can basically put them into an in-house program which does not include narcotics, and they'll go through 20 sessions, and by the end of 20 sessions, A, they will not need medication, and B, the problem will be resolved. And it's not a panacea. It doesn't work on everybody, but we have better than a 95% success rate. Why? Because we're working at the origin of the problem. We're not working on the problem. There's a gigantic difference in those two statements. So with that in mind, our second step in our system is to basically go in and correct the damage caused by the muscles not doing what they're supposed to do. And this could be a tear in a tendon or ligament. This could be joint problems such as carpal tunnel, such as any type of hip, knee, shoulder, back. Any type of pain that's basically radiating from and around a joint is simply not a joint problem. As a matter of fact, we tell all of our providers in training there is no such thing as a joint problem. The joint problem is where the problem ended up. We're not disputing the fact that it ended up there. We're not disputing the fact that there's inflammation there. We're simply disputing the fact that that's not where the problem is. That's where the problem ended up. So we train our providers into finding out where that problem is coming from, treat the origin of that problem, and then neurologically retrain the patient into a lifestyle that they normally would never have. Because if you're in pain, you're protecting yourself. So if it hurts on the right side, you're going to shift all your weight to the left side. If it hurts to raise your right arm, you're not going to raise your right arm. You're going to use your left arm. So those are all things we call compensation patterns. And in our system, we are going to get rid of those compensation patterns because they're not a physical pattern. They are a neurological pattern. And our system is based on neurology, not physiology. And what I mean by that is we're working on the software that has caused that movement pattern change. We're not working on the fact that you're shifting your weight to your left side. We're working on why you're doing that. So all of a sudden, if it doesn't hurt on the right side, there's no reason to shift to the left side. And so we consistently keep neurologically re-educating you, the patient, to where you move correctly, move efficiently, have greater range of motion, and more importantly, have no pain. So the second step of our system, which is critically important, is to fix all the damage caused by the first step not working. And then once we've done the second step, now what we have to do is we have to look at the body as a whole and say, hey, wait a minute. We've now got to create the ability to absorb massive quantities of force, therefore preventing these problems from reoccurring. So again, if you have an automobile and it doesn't have shock absorbers on it, all the force coming into the car is going to go into the frame. Well, consequently, if you don't have muscles that are acting as shock absorbers, all the force coming into your body is going into your frame, and that's your skeleton and your joints. And it is not designed to absorb force, just like in an automobile. A frame is not designed to absorb force. So obviously there's going to be damage caused there. So the first thing we're going to do is we're going to make sure that the nervous system is sending the right signal to the muscles to allow them to do what they're supposed to do. The second thing we're going to do is we're going to fix all the damage caused by the nervous system not doing what it was supposed to do. And the third part of our system, and probably the most important part, is we're going to create a pattern, create a movement pattern, and create the ability of the muscles throughout the entire body to absorb force so the force doesn't go to the joints, tendons, and ligaments. And consequently, you're going to have an active lifestyle as a patient that you normally would never have. So in a nutshell, and in the first 15 minutes of our show, I've kind of highlighted exactly what our system is. And it's called the ARP Wave System. And we have providers all over the world. And what we're doing is we're looking for providers in the Florida area, right in the Miami-Dade and West Palm areas, because we have a lot of patients who need help. I mean, Florida is probably one of the highest concentrations of patients with pain in any state in the union. Henceforth, the reason we're there. So, as a patient, we want you to be able to be treated by one of our providers at absolutely no cost to you to prove to you, can it help you or can it not? That's certainly a fair way of identifying, does the system work for you or not? We'll be right back and we'll discuss some of the questions coming in and answer your questions.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website, www.painmanagementnetwork.com, and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we are back, and just as you heard, we are looking for providers to satisfy the needs of many patients in the metro area. And in our first segment, we talked a little bit about the ARP Wave System. And now what I'd kind of like to do in this segment is give you an idea of some of the types of patients we work on and some of the results that we've achieved over the years. And over the years, we've treated about 75,000 patients all over the world, and many of them are the most elite athletes in the world. But the overwhelming majority are people just like you. People in pain, people that are told that they're bone on bone, people that are told that they have to have spinal fusion surgery, people that are told they have chronic pain such as RSD, which is now a new acronym called CRPS, people that have MS, people that are in basically wheelchairs for the simple reason as they've been diagnosed as an incomplete CV, people that have sports injuries, minor and major. So understand the system will treat you for any type of pain or any type of injury. And our providers are extremely skilled and very, very well trained by us in this totally new therapy. This is not physical therapy. Physical therapy is a completely different type of therapy, very, very successful, extremely effective, and takes years and years and years to learn. This therapy addresses the other side of that coin. And every provider listening today has been trained in physical medicine, unless, of course, they're neurologists, and then they're trained in the neurology of disease, not the neurology of injury. So this is a completely different therapy. It is not physical therapy, it's neurotherapy. I'll give you an example. I had a patient that came into me approximately 5.5 weeks ago. This patient came into us in our corporate offices in Minneapolis, and the patient was sent to us by their physician, and the doctor came in with him. He had had 5 fusion surgeries, could not move his neck probably any more than 1 degree. Was completely frozen in the upper body. To turn, he had to literally basically turn his entire body. He had been going to physical therapy and occupational therapy for approximately 4 to 5 years, almost on a weekly basis of time. And to basically no avail, and it wasn't their fault. The problem isn't a physical problem, and I know that sounds absolutely crazy because everybody thinks, "Oh my goodness, if I've got a frozen joint, if I've got a fused area, then I can't move." Well, my standard question to anyone who has that condition is a very simple one. Whether you're a provider or whether you're a patient, the question is this: did they fuse your muscles? And of course the answer is no. What moves you? Your muscles. What isn't moving you? Your muscles. Why aren't your muscles moving you? Because they're not getting a stimulus to do so. They are on vacation. They are in a pattern that says, just like the rest of your body, I can't move. So when this patient came in, the first thing we did is we followed the system, of course. We did a complete evaluation, and the physician was there, the surgeon was there. And as we went through this, we asked a lot of different types of questions. And once we got all the information, we did our first test, which is step one, to determine, is the nervous system working correctly? Now, the attending physician that was watching us do the test was absolutely amazed at what he saw. And what he saw was the body was totally 100% incapable of absorbing any type of force at all. This person, this patient, is approximately 6 foot, maybe 235, 240, and very, very strong lower body. And when I tested his lower body to see if he could absorb force, he could not absorb my finger pushing down on his leg. Couldn't absorb it. And force absorption is not strength. So I'm not testing to see how strong the individual is. The individual could probably squat many hundreds of pounds, but could not absorb any force. So therefore, all that force consistently kept going into tissue that it wasn't designed to absorb. So in that test, we identified that the nervous system wasn't working correctly. We then basically stimulated the nervous system with a very unique protocol, customized specifically for this patient. And after we did that, we then started working on the therapy. And the therapy involved simply relaxing, and that's a very poor choice of words. Muscles do not relax. They contract by lengthening, and they contract by shortening. And when you're free and able to move around, everybody says you've got relaxed and supple muscles. What that simply means is your muscles are able to go to eccentric contraction efficiently as they can go to concentric contraction. So think of it this way. If you open your hand right now, as I'm talking to you right now, just open your hand. And we'll say that this is eccentric contraction. Now close your hand into a fist, and we'll say that's concentric contraction. Well, if you're in concentric contraction 24/7, 365, I guarantee you're going to be in pain and you're not going to be able to move efficiently. So all we did is allow, not put into, but allow this patient's muscles to go into eccentric contraction. Now here's the difference. When physical therapists were moving this person's head, they were fighting the electrical signal that says, this is where I'm supposed to be. What we did is changed the signal, and when we changed that signal, and we have facilitated a change in the software, in other words, the way the information is being processed, and then we start moving this individual's head, guess what happened? An amazing thing happened. The head moved. And the doctor watching this could not understand how that was possible until we got deeper into the conversation and explained that this individual, because of the surgical intervention, because of the fusions, because of the Harrington rods, this individual was told they can't move. And because they're told they can't move, guess what happens? They can't move. But if someone else says you can move and shows you you can move, then an amazing thing happens. Your brain says, hey, wait a minute, I can move, and it doesn't hurt. So our job in the therapy side of the equation, in the step 2 of our system, is get the cognitive brain out of the equation and allow the nervous system to do what it's designed to do, which is help you move. So with this patient, I moved his head to the left, I moved it to the right, I moved it backwards, and I moved it forwards. And the maximum this individual ever got in physical therapy after years of physical therapy and never could maintain it was 10 degrees range of motion. In the very first session, we had 40 degrees range of motion. And not only did we have 40 degrees range of motion, but the individual could hold the position. So what we had to do then is begin a process by which we neurologically re-educate the muscles that they can move. They can move the head. And the more we re-educate those muscles, the more we move them, the more the brain sees that they're able to move, an amazing thing happens. Movement happens. Just because you have a fusion does not mean you cannot move. It simply means there's certain areas that aren't going to move. But your muscles, which move you, are not fused. So in this individual's case, and we took videos of it for workers' compensation program, they couldn't believe it. Because in years, he hasn't moved, and in one session, he did move. It's not a miracle. It's not anything magical. All it is not fighting the signal that's not allowing movement, but change the signal which allows movement. And more importantly, you have to consistently do it over and over and over and over again before the brain finally picks up on the idea that, hey, I can move. That is what we do with the ARP Wave system. We make sure that the software, the nervous system, is working correctly. We make sure the muscles are able to absorb force. We make sure the muscles are able to go to eccentric contraction, lengthening rather than shortening. And we reinforce that thousands and thousands and thousands of times a minute. Will I hear the sound? We'll be right back. Listen carefully to the voice coming up next. It will tell you how you can try the ARP Wave system at one of our providers at absolutely no cost.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave system to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we are back, and I have a number of questions that were sent to me via email. And I'll start with the very first one because I think it's a very interesting question. This individual writes that his mother, who has had migraine headaches for probably 10 to 15 years, has tried everything. Been on Imitrex, been on all of the different drugs, has seen many, many different providers, and just cannot get rid of the migraine headache. Constantly have a headache, every day, probably on a scale of 1 to 10, 10 being really high, 1 being very low. Typically right around the 3 to 4 range, and then about twice a week, that pain gets up into the 8s, 9s, and 10s, and almost becomes debilitating to the point where they can't work, they really can't function. And so they were asking me, do I think that the ARP Wave system could help? And the answer is, all I can say is that we've been extremely successful with many, many patients who suffer from the very same type of condition. When they see our doctors and do an evaluation and do a complete intake, we identify very, very quickly some of the main key components of that headache. And again, we're thinking on the neurological side, not the physical side. So let's start looking at some of the physical symptoms. So let's say that the very first question that we ask every single migraine patient is this: is your neck stiff? Well, generally speaking, it is. Do you normally feel tension in your shoulder muscles? Normally the answer is yes. Is there a specific movement that bothers you the most? Generally, they say any movement. But we identify by looking at them, and then invariably they're going to be holding their head to one side or the other. They are not going to be in a neutral position with the head straight up and down. One of the other things that we find out is that when we are testing and evaluation-wise, when we ask them to move their head as though they're looking over their left shoulder, invariably what is going to happen is that they break down. As they start moving their head to the left, instead of keeping in a neutral plane, they immediately break down to the left, to the right, forward, and backward. Typically, what that's telling us is this, that the muscles just quite frankly are not doing what they're supposed to do. We've all heard the term baby head, I'm sure, where a baby's head is really too large for the muscles to hold it up, so it flops around. Well, if your muscles in your shoulders are consistently in concentric contraction, remember that, how we were talking about eccentric and concentric, where we talked about the hand being wide open and then the hand being closed in a fist? When it's closed in a fist, it is in concentric contraction. Now, let me put this in a completely different perspective for you. I want every single one of you listening today to simply curl your arm as tight as you can. So in other words, just like you're a bodybuilder, just try to get your bicep to contract. And I want you to just keep squeezing and keep contracting that muscle. And within about 8 to 10 seconds, you're going to start to feel discomfort. And that discomfort is what? That muscle is contracting very, very hard, and it's almost creating a cramp. Well, what do you think is going to happen to your body when every single muscle in your body does that very same thing, and then it goes on every day of the week? That's exactly what we see with a lot of migraine patients, is their neck muscles are extraordinarily tight. Their scalenes, the muscles in the front, their anterior posterior deltoids, are extremely tight. Now, if the muscle is extremely tight, you just got a feeling for what that's going to feel like. And so sooner or later, it's going to put pressure someplace that it's not supposed to be putting pressure at. And generally what we find is that that pressure is going to the base of the neck. And for the providers out there, they automatically know what that means. That's the occipital ridge. And if you put pressure on the occipital ridge, I can almost assure you, you're going to have a headache of some kind. So it's not the headache that's the problem. It's what's causing the headache. It's the problem. And if you consistently medicate the fact that you have a headache, you've done absolutely nothing for the origin or the cause. Have you? And the answer, of course, is no. So what the ARP Wave System does is we find out, A, is the nervous system working correctly? And we've already discussed it a little bit this morning about how we do that. Well, we test the muscles to see can they absorb force or not. If they can't absorb force, then we know the nervous system isn't sending the right signal. So we got to get those muscles to be able to absorb force, and we have to have the nervous system firing correctly, sending the correct signal to the correct muscle to allow that muscle to absorb force. Because only then are you going to get the force out of the area that's causing the problem. And as long as that force consistently keeps going into that area, you're going to consistently keep having a problem. So let me ask you a question. How does medication solve that? It doesn't. It absolutely 100% doesn't. What medication does is take your mind off the fact that you have a problem. And then when you need more medication, it's because your mind automatically needed more stimulus to say, you don't have a problem, when in reality you do. Doesn't it make more sense as a patient to find out what's causing the problem rather than treat the problem? In the ARP Wave System, I think we all believe that that's the case. We should always try to find the origin of the problem. So with a migraine patient, and to answer the question that the emailer is asking is, do I think we can help them? Yes, I do. And do I think our providers can help them? Yes, I do. It doesn't make any difference if the provider is not familiar with our system. When we go through and we do our training of the provider staff, most of the providers will not be doing this therapy. Their staff will. Their staff will be trained by our company. Their staff will be managed by our company. And your results as a patient will be managed by our company. The staff member of the provider is there to support you. But we, on this side of the coin, are going to be managing those outcomes. And I can assure you that over the last 15 years, our average is 95% success rate. Now, there's not many providers out there that can make that kind of claim. And again, it sounds way too good to be true. How can it be that simple? How can it be that my muscles just aren't doing what they're supposed to do, and that's why I have a headache? Well, it can be that way, but there's only one way you're ever going to know if that is the case, and that is visit one of our providers. And we've got it down to such a fine-tuned science right now that we want you, the patient, we want you to know beyond a shadow of a doubt if our system can help you or not, and we want to take away all the risk, and we want to take away all the financial risk. So if you are in pain, if you have a migraine, if you have any kind of pain whatsoever, if you've been told that you need a joint replacement, if you've been told that you have to live with your pain, trust me, that is not the case. There are other options. Now, one size doesn't fit everybody, so you have to find out, does and can the ARP Wave System help you? And the only way to do it, the only way to know for sure, is to try it. So we're setting up providers all over South Florida. These providers are maybe your doctor. If your doctor is not one of our providers, I would strongly suggest you tell them about this program. You have them call us, and our call-in number is 954-256-0045. You tell them that you'd like to have a free treatment, and this company will treat you in his office or her office if they're not one of our providers. So we'll basically kill two birds with one stone. We'll show you the system works, and we'll show your doctor the system works, and by doing that, it's a win-win for everybody because now your doctor becomes one of our providers. We can start sending more patients to him or her, and you will know beyond a shadow of a doubt if our system will work for you or not. So it's a win-win for everybody. But the answer to the question, I do believe that we can help, but there's only one way to know for sure, and that is actually go through the system, make sure that you have plenty of food in your system, plenty of water in your system, because we're going to be testing you, and we need to make sure that you have the proper fuel. So it's a very, very simple system. It's very, very complex system. And what I mean by that is it's simple in its format. It works on the software, not the hardware. And I keep mentioning software and hardware. Think of it this way. Physical therapy, occupational therapy, athletic therapy, any type of strenuous therapy of any kind works on the hardware. None of those therapies are working on the software. So if you have a computer and you bring it into a computer giant and it is a software problem, and you bring it into a hardware supplier who doesn't do software, are you going to solve the problem? And of course, the answer is no. Absolutely not. Why? Because it's not a hardware problem. It's a software problem. So what if your pain is a software problem? And what if everyone looking at your pain is treating it as a hardware problem? Are you going to solve that problem? I submit to you, no. But there's only one way to know, is it a hardware problem or a software problem? And that is to try it. And if it costs you nothing, and it's convenient, and it doesn't hurt, and it doesn't create any discomfort, why in the world wouldn't you try it? So that's up to you. So if you're in pain, if you have a restricted range of motion, if you have any compensation pattern, and I can assure you every single person listening to this show today has a compensation pattern, even if you are an elite athlete. Now, hear our sounds. Listen very carefully to the next message you're going to be hearing.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website, www.painmanagementnetwork.com, and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Well, we are back, and for those of you who would like to ask a question, please contact us at painmanagementnetwork.com. That's on the web. That's www.painmanagementnetwork.com. And I have another question here from last week's show. And this question revolves around a 17-year-old boy, football player, by the sounds of things, quite gifted, who has consistently had hamstring problems. In other words, every time that he's competing or practicing, his hamstring bothers him. He's been treated by the athletic trainer, been treated by a number of orthopedic surgeons. Basically, he's told by reading his email that he is what they term injury prone. In other words, he's susceptible for injury. And he's asking, have we ever dealt with that type of situation? And of course the answer is yes. We've dealt with some of the most elite athletes in the world, and many of them would have hamstring problems at some point in time in their career. And again, let's start looking at what is the cause of the hamstring problem, not the hamstring problem. Because it's not the hamstring. I can tell you that right now. It's not the hamstring. And for this young man who lives in, it looks like Hallandale, I'm going to strongly suggest that we get him into one of the doctors in the Hallandale area and have a look at him. But typically, to answer his question, have we addressed this type of problem before? And I could give you, chapter and verse on how many athletes that we've had. But I'll just kind of give you an idea of what we would do. And if you're listening, this is exactly the format that you would go through. The first thing that we would do is we would do a complete workup. And the doctor would do the complete workup. They'd identify, have you ever had these symptoms before? When did you first have these symptoms? And then once that's all done and once all that knowledge has been gathered, then you go into the ARP Wave system. And the first thing we're going to do is test you. Now, you're going to think that this test is a strength test because we're going to have you lay down on a treatment table. We're going to have you raise your right leg up in the air with no bend in your knee. And we're going to apply light resistance on your leg. I can almost guarantee you right this second you're not going to be able to resist that. And now the reason I can say that is this. I'll give you a very simple analogy. Well, not an analogy, but I'll give you a very simple example. We went into a professional football team, and the head strength coach had pretty much the same situation. This strength coach was a very, very strong man, and he could squat, which means he could put weight on his shoulders and squat down like he's sitting in a chair. He could squat well over 700 pounds. But yet, his hamstring consistently always bothered him. And so when I laid him down on the table, and he's about 280 pounds, about 6'6", 6'7", 280. When I laid him down on the table, I told him, I said, Coach, I'm not going to test to see how strong you are because I know you're as strong as a horse. I'm just simply going to test to see if you can absorb force. And he said, okay, go ahead. And I said, raise your right leg up and no bend in the knee, and I want you to resist as I put pressure on it. And I put just a very little bit of pressure and his leg came down. Now, if you were there and you could have seen his eyes, they looked like saucers. He could not believe what he just experienced because, again, This is a guy who squats with hundreds and hundreds and hundreds of pounds, yet he could not resist me pushing down on his leg. Absolutely couldn't do it. I said, okay, let's test the other leg. And we test the other leg, the same thing. His answer to me, and now keep in mind, this is a NFL strength coach. His question to me is, how is that possible when I'm as strong as I am? Now, the reason he asked me that question, and the reason you, this emailer, I won't use your name, but the reason you, the emailer, asked me this question is because you equate strength to the ability to absorb force. And I submit to you, and I submit to anyone in athletics, and I submit to anyone who's not in athletics that is going to the gym on a day-to-day basis because of their pain or their restricted range of motion. I submit to you that what you're doing in the gym has absolutely nothing to do with your ability to absorb force. So you can get very, very strong, and if you cannot absorb force, you are not going to see a change in your symptoms, ever. Now, getting back to the hamstring. So the first thing that we would do is test you. I can almost guarantee you, you'll fail. Not because you're not strong enough, it's because you can't absorb force. Now, the way I know you can't absorb force is what you say in your email. And your email says, point blank, I've had this for years. I've been diagnosed as being injury prone. I consistently, year in and year out, you're only 17 years old, year in and year out, I have a hamstring problem. I treat it, goes away, and then it comes back. Well, you treat it, and it doesn't go away, and it's going to come back. Why? Because you have not treated the cause of your hamstring problem. You have treated your hamstring problem. And my friend, it's not your hamstring that's the problem. It's the nervous system not sending the right signal to your muscles, which probably are going to be your quads, the front of your leg. Because the hamstring is the antagonist to your quad. And if your hamstring is having a problem, then I almost guarantee you your quads have a problem. So, the first thing we're going to do is test you. You'll probably fail. We then will have the provider, their staff person, utilize our protocol, and we'll basically re-stimulate your nervous system, bring you back to where it's working, kind of like resetting a computer, and now your nervous system is working, and now the muscle will absorb force. Then the next thing we're going to do is we're going to basically find out, we're going to use our proprietary tool, and again, for the providers listening, you're the only ones that are going to be able to use this proprietary tool. You're the only ones that are going to be able to use our technology to basically treat patients in the area. So we're going to use this proprietary tool. We're going to put one electrode right where you say it hurts. And we're going to take another electrode and we're going to put it off to the side of your body. Going to get it out of the way completely. We're going to turn the power up until you tell us you feel it. And then we're going to ask you, on a scale of 1 to 10, the sensation, it will never be painful, the sensation you're feeling, what number is it? And you'll probably give us a very low number. Well, we know beyond a shadow of a doubt at that point that that hamstring is where the problem ended up, not where it's coming from. But we don't make that assumption. We don't assume anything. So now we're going to start moving this electrode around. And as we're moving it around your body, we're looking for the origin of the problem causing your hamstring. Once we find that area, and it will become very clear to us and very clear to our staff person when we find it, we then are going to anchor that electrode right there. We're going to turn the power down. We're going to bring the red electrode off from the other side of your body, and we're going to put it right back where you felt it on your hamstring. Now we're going to turn it up again, and we're going to say, what's that feel like? Is that more or less than what it was when it was over here. And it'll be less. So then we say to you point blank, hey, this is where the problem ended. This is not where the problem is coming from. So now we're going to start moving your red electrode around your body. We might find a spot in your quad, on your right side, and in your upper trapezius on your left side. I have no idea where we're going to find a spot. But wherever we find that spot, wherever that proprietary tool tells us that spot is, no matter how illogical it is, and for the providers listening, I guarantee you the hardest thing in the world for a provider to understand is they know where the problem is. They've got an MRI, they've got an X-ray, they've got all this telling you where the problem is. And when we start treating it, it's nowhere near where the problem is, but we get rid of where the problem is. How is that possible? We're treating the software controlling the hardware problem. That's what we do. That is how the system works. So to answer your question, we'll get you into a local provider and we'll get your hamstring from the constantly injured side to the efficient, productive side. Till next week, this is Denis Thompson. Thank you very much for your time.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.